Hello, welcome to today's episode on Life Saving Aid. Today we are going to be looking at what to do for a victim of gunshot injury to the abdomen in order to help increase their chances at survival. The abdomen is the part of the body commonly referred to as the tummy. When there is a gunshot injury, like in this case, to the abdomen, what do we do in order to help increase their chances at survival? It's important to mention at this point that the best when it comes to gunshot injury to the abdomen is to prevent it from happening. And how do you prevent it from happening? Ensure you remove yourself from environment that places you at risk of being shot at any part of your body. There are a lot of videos flying on self-defense whereby you see people at gunpoint and then they are trying to teach you what to do in order to hit the gun from the hand of the assailant. Please and please, if you can beg, beg. If you can run, run away. Don't try to engage someone who is holding a firearm. Please and please, that's the best you can do. Prevent gunshot injury. There is no guarantee when it comes to gunshot injury. However, there are things you can do in order to help increase the chance of survival of the victim. In the case of gunshot injury to the abdomen, first and foremost, ensure that the scene is safe before trying to rescue the victim or before trying to help the victim. Because if the person who shot the victim is still there, you might be the next target. So ensure that it is safe for you to respond in order to help the victim. Now you get to where the victim is. Hello, hello, are you feeling okay? You're feeling pain? Do you know where you are? What's your name? Now, when someone has been shot, it's important to continue to engage the victim in a conversation, to keep the victim calm. So a victim that has been shot who is talking has a better outcome than someone who is not talking at all. So you get to the scene, you assess, and the scene is safe for you to respond, or you get the victim to safety. Next, you try to locate where the bleeder is coming from, while at the same time you're trying to call emergency medical services, be it your 911, depending on the country you are in. You call emergency, you activate emergency medical services, while at the same time you're trying to reassure the victim to keep the victim calm. Remember, if the victim is agitated and anxious, which is the normal response, because anyone who is being shot, there is usually a feeling of impending doom. Or what you do is to help reassure this victim. How do you reassure this victim? How do you help calm this victim? You tell the victim, hey, don't worry. There's chance, there's opportunity. Help is on the way. We are doing all we can to get you to the hospital as soon as possible. Don't worry. Keep fighting. Don't give up. Help is on the way. You lay the victim on their back to locate where the bleeder is. Please and please, when it comes to helping a victim who have been shot, there will be blood stain everywhere. The major thing you're trying to help them do is to reduce the rate at which they are bleeding before they get to the hospital. Getting to the hospital is the most important thing you can do for that victim. So in countries where you can activate emergency medical services, please activate emergency medical services right away. Or if it's to call the police, call 911 and all the right away. The whole goal is to ensure that the victim is moved to the hospital as soon as possible. But while you're trying to do that, you have to help the victim reduce the rate at which they are bleeding. Please and please, at this point, let me state that it's important you know that the bullet in the body of the victim is not the problem at that point. The bleeding is what will first kill the victim before the bullet itself. So please don't try to want to dig in to bring out the bullet. No, you are complicating the situation of the victim. Don't go and pack sand or dirt to try to pour on the surface of the wound that you want to stop the bleeding or is going to help. No, you are not going to help. Please do not also take alcohol and be pouring on the site of the injury. You are not helping the victim. Please and please don't do that. Your job is to move the victim to the hospital as soon as possible. But while you are trying to do that, you are trying to reduce the rate at which this victim is bleeding. So how do we help this victim reduce the rate at which they are bleeding? Number one, we've said that you should reassure the victim. Try to help keep the victim calm. Now, the next thing you do is to get to the point where the bleeding is coming from and apply pressure. And I'm going to show you how we're going to apply pressure. Please and please, if you don't know the victim, it is not safe to go with your bare hands to try to stop the bleeding or do anything for that victim at that point. The reason being that when you're trying to help someone, you shouldn't become a victim of infections that can be transmitted through blood, except if you know the retroviral status of the victim and the hepatitis status of the victim. Now, in order to help this victim reduce the rate at which they are bleeding, you get a pair of gloves, you put it on. In the absence of gloves, if you can get clean, new nylon bags, you can put your hands inside to help instead of doing nothing. I put on my gloves, Remember, I've activated emergency medical services. Where it's not available, I've already made provision. Please, Mona, help us call driver. Let's get this victim to the hospital. Please, can someone help us get a driver so that we can move this victim to the hospital? While all of that is going on, okay, I quickly get a clean towel or a clean cloth. Please, when it comes to gunshot injury to the abdomen, the use of cotton wool or little piece of cloth is not helpful. And the reason is simple. The abdomen is like a bag containing different organs. When you put little cotton wool here or little piece of cloth here, it can go missing in the abdomen, and that becomes another problem. So what do? Get a clean cloth, something that is big enough. And how do you secure the bleeding? You get an edge, you dip into the space. Remember, gunshot injuries, they are puncture wounds. So what it means is that you will see a hole. It might not be big, it might be little, depending on the size of the bullet. So what do? You go with your fingers this way, you look for the hole, and you start plugging it in. You keep putting it in, okay, in, until it is fully packed. You keep putting it in until it is fully packed, and you apply pressure. Why are you applying pressure? You are trying to ensure that the bleeding significantly reduces. That way, you will be helping this victim increase their chances at survival. While you are doing that, you are waiting for emergency medical services to arrive to take over from where you are. But if it's in a situation whereby emergency medical services is not around and you need to transport this victim to the hospital, you cannot stay this way because you will still be the one to help carry this victim into the car and all that. So what do? When you've packed like this, you get another cloth, something long, that you can use to secure this pressure there. You tie it around the abdomen of the victim. Like, get a cloth and you tie in order to sustain the pressure on the wound so that the bleeding will reduce. While you are doing that, remember that you're making provision for a vehicle to come, okay? You ensure that it is well secured, okay? Please make sure you tie it very well. Okay, that way pressure is sustained, and then you can help move this victim into a car to get to the hospital. Now, in the event whereby while trying to help the victim, you notice the victim suddenly stops talking, it's not conversational, it's no longer responsive, probably because the victim has bled excessively, or probably the victim is already in shock, be it from neurogenic cause, even anxiety. Some people will just pass out realizing that they've been shot. In such situation, what do? You look at the chest wall. Is it rising and falling to know if this victim is breathing? You go to the carotid pulse, which is at the junction. You feel it at the junction between the lower parts, the lower border of the jaw and the neck. You press deep to feel for pulse. If there is no pulse, it means this victim has gone into cardiac arrest. So while you've secured this, you come to the chest and you start cardiopulmonary resuscitation immediately. You start CPR immediately. How do we give CPR? We keep giving chest compression deep and fast. To what part of the chest? In this situation, you expose the chest of the victim, okay? The middle of the lower part, okay? The middle of the lower part of the chest. You clench your fist like this, okay? And your elbows locked. You start giving chest compression fast and deep like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, like 30. You keep going until you are able to deliver between 100 to 120 chest compression every minute. You keep this chest compression going until the victim becomes responsive. What's happening? In that situation, when the victim is responsive, please do not continue to press the chest of the victim. You will complicate situations for the victim. So when the victim regains consciousness and responsiveness, don't continue chest compression, you stop. 2, when emergency medical services arrive at the scene where it happened to take over the resuscitation of that victim from you. Or 3, when you get to the hospital. So it means that even in the car, if you are opportune, you continue to give chest compression until you get to the hospital. I hope this video helps someone out there. Please stay safe out there. Avoid what will make you a victim of gunshot injury, be it to the abdomen or any other part of the body. Share this video so that together we can help save many lives.